Welcome to the Almost Effect website, brought to you by Harvard Medical School. I'm Dr. Julie Silver, and I'm an assistant professor at Harvard Medical School, as well as the chief editor of books at Harvard Health Publications. I have the privilege of working with my colleagues on health books for the general public that offer information about cutting-edge research and new ways of thinking about health and healing. The Almost Effect is a concept that we developed at Harvard Medical School after looking at hundreds of research studies and realizing that in nearly all medical conditions, there are symptoms that are recognizable even before reaching the point of a clinical diagnosis. For example, in people who may be at risk for developing hypertension, there are usually telltale signs of elevated blood pressure that occur for many years in advance. The same is true for those who have diabetes. In medicine, we often call these early signs a subclinical syndrome, which means that it's below the level of an actual diagnosis, but it isn't normal. You may have heard about the kinds of examples that I just used, elevated blood pressure or glucose levels, because these have been in the news a lot. So, we know that medical problems, more often than not, present along a continuum, going from normal to clinical diagnosis. However, there's been a big gap in evaluating the middle part of this continuum. When you move out of the normal range, but you don't quite fit the criteria for a formal diagnosis, what does this mean? And how does it affect your health and your ability to have the best quality of life possible? For instance, imagine a hardworking father who comes home to his wife and 3 school-aged children. He's a good man and trying to do the right thing by his family. But he has a lot of stress. To alleviate his stress, several times a week, he drinks 2 to 3 beers. After a long day at work and not enough sleep to begin with, the alcohol makes him feel tired. So, on the nights that he drinks, he generally goes to bed early, leaving his wife to manage the kids' homework and bedtime routine alone. Clearly, he's missing out on spending time with his children and his wife. But when his wife gets upset with him and says that he drinks too much and probably is an alcoholic, he tells her, rightly so, that he isn't an alcoholic. She responds with, "Well, you're almost an alcoholic." In this situation, there isn't a formal diagnosis to be made, but there's obviously a lot of suffering, with a ripple effect that extends beyond this couple to their children. This is an example of why we say that almost isn't okay. Because with the almost effect, there is real suffering that needs to be addressed. And the only way to address it is to first recognize it as a problem. In this series of books from Harvard Medical School, we're sharing information with people about this middle space on the continuum that is causing so much suffering and suboptimal physical and emotional health. When you read the Almost Effect books, you'll see that there's a lot of scientific research that explains these subclinical problems and what interventions might help. Our goal is not to label people, but rather to recognize that there's a continuum from normal to serious illnesses in both physical and mental health, and that it's important to recognize when someone moves out of the normal range and intervene appropriately. We appreciate your interest in the Almost Effect and encourage you to explore our books in this series. At Harvard Health Publications, we offer you research-based information and trusted advice so that you and your loved ones may live healthier and happier lives.